Morning. Yes, it is Michelle. I want to explain why I look a little different today. I've been talking about caregiver issues and caregiver strain. Well, I'll share part of my personal story with that. Because of a lot of the stress that I've been under as a caregiver, I have lost all of the hair along my front hairline. And so, because of that, I've been wearing wigs. I was ashamed and embarrassed about how I looked. And I wore the wigs, and they didn't really make me feel that much better about myself. So, I just accepted the way I looked. And after I accepted it, I decided to do something about it. So, I got my hair cut to a very low style, and I love it. And so I went from accepting it to owning it. So I own this look, and I'm happy with it, and I feel free from having to, look for wigs and maintain them and, find someone to make wigs for me, all those kinds of things I went through. And so I feel free. And so this is why I look the way that I look today. And so, since we've gotten that elephant out of the room, the next thing that I want to do is talk about the second part of dental care as it relates to taking care of our loved ones. So, here we go. Um, we've already talked about some of the issues and concerns, and so now I want to go over some more tips about dental care for our loved ones. So, first of all, you don't have to use the sink. If it's difficult for your loved one to bend over and use the kitchen sink or use the bathroom sink, just know that you don't have to use that sink to brush their teeth. You can get a basin and have them sit down at the counter and put that basin on the counter and have them bend over slightly to brush their teeth. Or, I know this may sound a little gross, but you may have to do it, or you can brush their teeth in the kitchen sink and afterwards disinfect the sink. You can get an electric toothbrush that has a larger handle, or you can find large handle toothbrushes on Amazon if they're having trouble gripping the toothbrush. I'm going to give you a link to Amazon's website, to the page that shows a list of large handled toothbrushes or toothbrushes that have attachments for toothbrushes that can help your loved one grip them better. If you're concerned about whether or not your loved one is going to swallow the toothpaste, you don't want them to swallow a fluoride toothpaste or a fluoride infused mouthwash. So you can get fluoride-free toothpastes. There's a company called Tom's, Toms, that makes a toothpaste that has no fluoride. And you can also use baking soda. Back in the old days, people used baking soda to brush their teeth, and it'll really leave your mouth feeling refreshed. You can use anti-plaque mouthwash to help prevent gum disease. And some of these mouthwashes also help with dry mouth. If you have dry mouth and you don't prevent saliva, that can also contribute to gum disease. So you can get Listerine makes, I think, dry mouth mouthwashes, but there's a company that I bought from. It's called TheraBreath, and they have a good line of dental products, including toothbrushes that can prevent dry mouth. Now, what you want to do is look for signs of dental problems. Sometimes if you notice that your loved one is flinching or just, patting their jaw when their face is washed, or if they're nodding or shaking their head, that may be a sign that they are having dental problems. If they refuse to brush their teeth, or if they refuse to wear their dentures, that can also be a sign that they're having dental problems. Another thing you can do is go to the dentist more frequently. What I do now is I take my loved ones. They had serious dental problems when they moved from Mobile to up here with me. So what the dentist recommended is that my parents come every 3 months instead of every 6 months to get a cleaning. It's difficult for them to get to all of the spots and spaces that need to be brushed and flossed. So they go 3 times a year instead of 6. Finally, you can find a dentist who specializes in working with people with special needs or the elderly. Blue Cross Blue Shield, for example, has a list of providers on their website, and you can do a search on their website using keywords special needs, dentist, or dentist for elderly, and they will have a long list of dentists, especially in the Birmingham area, who specialize in working with seniors or people with special needs. So once again, I hope this helps. And I just want to let you know that for a long time, since I started the group, we've been talking about caregiving for your patient with dementia. So now it's time for us to talk about caregiving issues that relate to us as caregivers. If we don't take care of ourselves, we can't be good caregivers. So beginning tomorrow, I'm going to give you an introduction to what we're going to be talking about. And I encourage you to tell your other friends who are caregivers to tune in, join the group, because for the next month or so, we've got a lot to cover, because it is very important for us to take care of themselves. Like I said, I lost a lot of my hair because of stress associated with caregiving. And you never know how your body is reflecting the stress that you're under as a caregiver. And I would hate for y'all to get sick or have any kind of losses like I've had over the past 3 to 4 years being trying to be a caregiver for my parents. So I hope you guys have a great day, and I will talk to you tomorrow, and take care of yourself.